Have you ever noticed something unexpected when you use the restroom, something that instantly sparks concern? It is natural to feel a bit alarmed, especially when it comes to changes in your bowel habits or the appearance of your stool. One such observation that often prompts worry is the sight of red blood. Red blood in your stool generally indicates bleeding somewhere in your lower gastrointestinal tract, such as the colon or rectum. While it can be a sign of something minor and easily treatable, it always warrants attention and a conversation with your healthcare provider to understand its source and significance. It is your body's way of telling you to investigate further. The presence of bright red blood suggests that the bleeding is typically closer to the end of your digestive system, meaning it has not traveled far before exiting the body. Common culprits include hemorrhoids, which are swollen blood vessels in your rectum or anus, and anal fissures, which are small tears in the lining of the anus, often caused by hard stools. These are usually not serious conditions but can be uncomfortable. However, red blood can also signal more significant issues like diverticulosis, which are small bulging pouches in the colon, or inflammatory bowel disease, which involves chronic inflammation of the digestive tract. In rarer cases, it could point to polyps or even certain types of cancer, which is why professional medical evaluation is so important. When you notice red blood, pay close attention to its characteristics. Is it bright red and fresh or darker and mixed in? Is it on the toilet paper, in the bowl, or mixed with the stool itself? Note if it appears with pain, changes in bowel habits like constipation or diarrhea, or other symptoms such as weight loss or fever. These details will be very helpful for your doctor in pinpointing the possible cause. Do not try to self-diagnose based on color or amount alone, as even a small amount of blood can be a sign of something important. Understanding the difference between hematochezia and melena is also key. Hematochezia refers to bright red blood from the lower gastrointestinal tract, while melena is black, tarry stool that indicates bleeding higher up in the digestive system, where blood has been digested. Knowing which type of bleeding you observe can guide your doctor toward the right diagnostic tests, such as a colonoscopy, to visualize the inside of your colon and rectum. Sometimes, conditions like angiodysplasia, which are fragile blood vessels in the intestinal wall, can also be a source of red blood, and they often requiring specific detection methods. Ultimately, observing red blood in your stool is a cue to seek medical advice promptly, rather than a cause for immediate panic. By providing your healthcare professional with clear, detailed observations, you enable them to accurately diagnose the underlying issue and ensure you receive the appropriate care. Your digestive well-being hinges on listening to your body's signals and taking proactive steps for your health.